welcome back to Spondylolysis Treatment Part 2. Now at this point I assume that you have already watched our first video, and I'll also assume that you have done the 2 months of therapy that were outlined in it. But before we get started on the additional therapies that we're going to add in Phase 2 of your treatment, I want to bring up a point about recumbent bicycle. If you're like most people who've been diagnosed with spondylolysis, you're depressed. It's scary. You've gone through a dark time in your life. You feel like you're not ever going to get better. Don't worry, you are. Just keep at it. But to help you get through those dark times when you feel like you're doing nothing and sitting around the house on the couch all the time, I recommend you go out to Walmart. They sell very inexpensively, and buy yourself a recumbent bicycle. Again, their low-end models are not that pricey at all, and it allows you to get a little bit of cardio exercise in during this dark time of your life, so you'll feel better, help your emotions get a little better, help your heart and lungs stay active. One note though, if you decide to get a recumbent bicycle, there's one thing you need to do different. Do not extend your leg all the way when you're biking. That tends to cause you to twist your back or overextend your leg. So just make sure you set the seat setting close enough to where your leg does not go all the way out or the full extension. Anyhow, now we've discussed that, let's get on to your Phase 2 therapy. Okay, first of all, for those of you who are thinking, all right, I can't wait to do something different from all that horrible therapy I've been doing the past couple months, I've got some bad news for you. You're pretty much going to continue to do all the therapy that you did the first 2 months. The difference in Phase 2 is we're going to just drop a couple of the exercises, we're going to tweak a couple of the exercises, and we're going to add a couple new ones to you. And that'll be it. So let's get started. Okay, let's start with the exercises you don't have to do anymore. Unfortunately, they're the easy ones. You no longer have to do the crocodile breaths. The purpose of them was just to get your muscles used to firing and working, and hopefully that has taken place by now. The second one is the transverse abdominal, fancy name there. That's where you lay on your back, holding the pole out with someone pulling it and pushing it and twisting it. Don't going to do that anymore. Wasn't that easy enough? Okay, next let's look at the couple of exercises that we're going to alter. We are going to change the way we do clams, and we are going to change the way we do the back bridge. So let's get a look at them. Okay folks, here's how we're going to tweak those clam exercises. Traditionally, you were laid on your back and just spreading your knees apart. We're just going to make one simple change to that. You will lay on your side and raise one knee. You'll find this works your hips a little bit harder than the last version did. And you'll need to do this on both sides instead of just laying on your back and doing it once. Still, the same rules apply, 15 to 20 repetitions, 2 sets. Now let's look at how we were going to do the back bridge. Your traditional back bridge was a static position. You would hold your hips up in the air without overextending it. Well, whatever amount of time you were holding it in Phase 1, you're going to do the same amount of time in Phase 2, with one difference. For instance, if you were holding it for 1 minute, instead of holding it for 1 minute in Phase 2, you will hold one leg straight out for 30 seconds, and the next leg straight out for 30 seconds. And folks, that is it. Lastly, we got 2 new exercises for you that I just know you're going to love. Okay folks, we have 2 new exercises for you today. They are the star and a front plank with an arm lift. The star is fairly simple. You'll get on your side and make sure you do not arch your back backwards. You want to keep a nice straight line, or if nothing else, a little bit of a bend to where my feet and my chest are slightly ahead of my pelvic region. You will have one leg bent and up on your elbow, and you will raise one leg. 1, 2, 3, 4. You will do that 15 to 20 times on each side, 2 sets. Your second exercise is going to be a plank with a front arm lift. It's very similar to the plank that you've seen before. You'll get in plank position and extend your arm out. 1, 2, 3, 4, 5. You will do this 15 to 20 times for each arm. And that's it for the new exercises. Well, folks, now you have a game plan for the next 3 to 4 months. As always, run these things by your doctor or your physical therapist because your condition may be different than what is called for in this particular therapy. I wish you the best. Keep working at it. You're going to get better, and may God bless you.